Okay. Yes. All right. All right. So, hello, hello, hello. I am Kiana, your friendly neighborhood trainer, and thank you for tuning in to our Women's Health series. I'm a woman. I care about my health, and a lot of my clients are women, and I care about their health. So that is why we wanted to make sure that we offer different topics that maybe you have some questions about and that can help others. So I am going to go ahead and shift over. We have two guests on. Thank you so very much for both of you being on today. And we're going to talk about endometriosis today. And we have two experts, subject matter experts. So we have Dr. Troy, who she is a MD. She does GYN gynecology, cosmetic surgical procedures as well. And then Miss Tara, well, whereas she has actually suffered with endometriosis and has since overcame it and is sharing the word about how great life is afterwards. So I'm going to shift over. Dr. Troy, if you want to introduce yourself.
Hi, everybody. I'm Troy Hailparn. I'm an OBGYN. For the last 20 plus years, I focused on cosmetic plastic gynecology. So I deal with issues related to menopause. I deal with issues related to sexual function. So incontinence, hormones, changes from childbirth, all of those things are what my practice focuses on now. But as an OBGYN, for the first dozen years in practice, I dealt with a lot of patients with endometriosis. And it's unfortunate, but pain is the number one symptom. And a lot of women have it, don't know they have it until they've either had an operation for some other reason and it's found just, by the way, this is what we found, or until it becomes symptomatic. And probably there's a prevalence of like 40 to 20% of women out there will get it over their lifetimes. But once you hit menopause, it goes away because it's stimulated by estrogen primarily. And I have a very, so how does it happen? Just so people know what is endometriosis? Everybody has what's called retrograde flow of their fluids, and they go back out the tubes and into the abdominal cavity, and some of those cells can seed in the abdominal cavity or on the ovary or on the tubes themselves, and every month actually be stimulated to grow. And so one can get in the ovaries, one can get implants in the pelvis, have small implants that can be deep and on a nerve and be terribly painful, and you have large implants that are painful, but often cyclic because it occurs more with the period and your menstrual cycles and when your hormones change. And so women who have painful menstrual cycles, especially longer ones, they have increased risk for more retrograde flow, are ones that are at increased risk. And of course, you can take anti-inflammatory medications to reduce discomfort. There's hormonal treatments for it. There's surgery treatment, depending on how serious it is. And if there are cysts diagnosed, ultrasound or CAT scan, MRI, those need to be removed and drained. And ultimately a hysterectomy if there's a lot of adhesions and damage inside the pelvis. So I have actually, and I know since you've gone through this, but I have a that displays the damage and how implants, and I want to just put it up for the purposes of you being able to see. Okay, this on this side, you can see a big called a chocolate cyst, and these lesions that can occur, and these bluish things are small implants. This can occur all around the abdominal cavity. So that's what's visualized when somebody goes in with what's called a laparoscope, which is down here. It's a camera where you can stick it through the belly button and shine a light. And really the only way to diagnose endometriosis is by seeing it and biopsy. If you feel it every month and someone says, well, you have endometriosis, they can't guarantee that's endometriosis. It can be something else. And the diagnosis, looking and seeing and biopsy. So I just hope this drawing is helpful. And you can see how on this side, it can actually go all over the abdominal cavity. Implant on the bowels, actually very severe disease. There's 4 stages, and that would be stage 4. Okay, so that's an overview of endometriosis. And, you know, we, the hormone options are usually what people try first because they're the least invasive, but surgery and then the hormonal options can help. And I would like to turn this over to Tara, who has experienced and gone through it, and you can share with us what you've been through and how you've improved and what you would tell them.
Well, let me interject right there. You kind of dove right in there. I just was asking you to introduce yourself, and you went right in there. But I do
Ah,
appreciate you for doing so, because I wanted to say that I didn't realize that a lot of women didn't even know what it was, and I also am glad that you mentioned the symptoms, because again, you may just think you're having, maybe terrible cramps or so forth. So I'm glad that, you clarified what to look for, because a lot of times we just don't know what to look for, and we don't know what we're looking at. So that definitely helps. Now, like you said, Tara actually, she suffered, but she overcame. So yes, ma'am, do share your story.
Yeah, thank you so much for having me. This is amazing to be talking with both of you. And I loved what you're saying, Dr. Troy. Sorry, Dr. How do you say your last name?
it's Hailparn, like rain, snow, sleet,
Yeah.
and hail, and on with a
Okay.
P. But Dr. Troy is fine.
Okay.
Dr.
Thank
Troy
you.
is, man, she's cool. We love her.
Okay, thank you both. Thank you, Dr. Troy, for explaining that. My name is, yeah, I'm Tara, and I live in Canada, and I started getting pain when I was like 12, 15 years old. When I was 15 years old, it started to get really bad that I would be fainting because I was in so much pain. And as I got older into my teen years, my family and I, we just thought this was Tara's normal. This is just how it is when Tara's on her period. She just needs to lay down because she's going to faint. And when I moved into my own apartment after living with my parents, we actually ended up looking for an apartment that was one level because it was so scary that I would be fainting and possibly fall down the stairs. So it was at that point when I would be fainting and living on my own, and I was a school teacher at the time, that I realized this is not safe. This is not safe for me to be taking care of kids and to be living on my own and having this much pain that I can't take care of myself. So I started digging deeper for answers. And I was 21 years at the time, 21 years old. And as the years went on, it got worse and worse. And I was so much more exhausted from the pain. And living on my own, I was digging for answers. I went to many different gynecologists, different specialists. I drive 6 hours round trip for a 15-minute appointment. And it was really, really awful. In my first 2 years of marriage, I had lots of different treatments that I tried, and I would bring my list, my notebook of like, these are the things I've tried and that didn't work for me. And it was 25 different things that, different painkillers, different types of birth control, different things like an IUD, things that, the doctor would say, this is to stop the cycle of the monthly cycle that women go through. And it just wasn't helping. It was getting worse. And I was told, and I know the way that Dr. Troy was explaining, a lot of women don't know that they have it because people don't talk about it. We don't sit down with our friends and you're pushing your child in the swing and talk about your uterus or your pain. Like, you don't talk about that. So that's why I think a lot of people don't know about it. And my husband was super supportive, and he walked through all of those different treatments with me. And one day, after I had gone through a miscarriage, which is, from what I hear, quite common for women who have endometriosis, infertility is quite common as well. I was at the lowest point. I hit the rock bottom, and I was suicidal thoughts were going through my head. I thought my husband has to deal with this every single day. He's being called 3 times a week to come pick me up from my teaching job at school because I'm unwell. And that's when I said, I will do anything. And I came across an interview with this lady, and she helps women. The way that she was talking about helping women and helping them, her company is called Visibly Fit, and she helps them to use their body as their gym, and to eat foods that fuel them well, and talking about anti-inflammatory
Mhm.
foods and that kind of thing. I thought, I really
Mhm.
need to talk to this lady.
Mhm.
So I talked to her, and we talked on the phone. She's from the US, and her name is Wendy Pett. And that same day that I talked to her, I started her 7-week program where she helped me to maximize the power of anti inflammatory habits in every area of my life. Things that I had not
Mhm.
tapped into. The stress from being in pain for so long, the stress was piling up and just trickling into every aspect of my life, my relationships, my work,
Stress.
and yeah, my marriage.
Mhm.
And that stress was building up, and it was creating more pain. In social situations, I noticed the pain increase.
Mhm.
In
Mhm.
situations where work was busy, the pain would increase, and I'd be coming home and in bed by 6 p.m. every night so that I could refresh for the next day going to school. So when I went into her program, I started all of the habits that she taught me. It was a very intense learning experience, but so good because I was able to become pain free. I had no more pain when I had hit the 1 week mark in the program. The antidepressants I was taking, I was able to drop 3 weeks later because I didn't have that stress anymore. And this was when the world shut down in 2020,
Mhm.
and I
Mhm.
was teaching from home at the
Mhm.
time, going for walks myself. And then several months later, I decided I'm going to stop taking the hormonal medication that I had continued to take just as because I wanted to. And so I consulted my doctor, and they said it was fine. And I went through several periods of no pain. I went through the complete cycle, no pain, and I was able to get pregnant after that. So now I have a
Wow.
1-year-old baby who
Mhm.
I was told would never exist. After going
Yes.
through 25 treatments that didn't work, I was
Mhm.
told by doctors, you know what, this is your life. Go home, accept that pain is your life, lay in bed, wait till menopause, and
Mm-mm.
you'll feel better then. And that was 25 years old. So my heart goes out to those
Not
women who are
acceptable.
suffering. No, suffering in silence because they don't know that that it is not a life sentence. That you can go for walks with your husband. You can enjoy your life, and you don't have to accept that news that your bed is now your home for the rest of your days.
Man, so I like the way both of your story and your information tied in together. Like you said, it's not something that you talk about. You don't exactly talk about it over coffee. Girl, you know what my uterus is doing today? No, no one is talking about that. But like you said, so you're going through this pain, not sure, you've normalized it. And it's become part of your day to day, like Dr. Troy said, pretty much, you suffered through this until you hit menopause. And menopause, where, a lot of women are like, oh my goodness, shoot, if you have endometriosis, you may be like, bring it on. I just, so I definitely see, like you said, how knowledge is power, because obviously, like you said, now, Dr. Troy, let me ask you something. Like Tara said that once she, kind of started changing her eating habits, which, co-sign on that. But she focused on anti-inflammatory type dietary, choices. So if someone comes to you and they say, I'm Tara, symptoms, I'm fainting, during my cycle. I'm, in excruciating pain. What is the first, if someone, because I'm pretty sure, like you said, she said she had 25 different treatments that she had tried. So what would be like the first thing that you would suggest?
Well, first you evaluate the patient. They come in, they're complaining of pain related to their cycles. Well, it's usually cyclic pelvic pain. Okay. And so the uterus may or may not be involved, except that it's the vehicle for spreading the endometriotic implants. So the whole of hormonal therapy is to stop the cycle from occurring, to put baseline steady state and suppress estrogen. So things like progesterone dominant treatments. And they do work for a lot of women, but not everybody. Diet is so important. I mean, in everything that we do. And when women come to me, even now in my practice, I always look at the whole person, because what we eat affects our bodies, whether it's caffeine or sugar or, and with endometriosis, high magnesium foods are anti-inflammatory. So pumpkin seeds, sunflower seeds, avocado, almonds, things like that, beans, black beans especially. All of those are anti-inflammatory and should be incorporated into the diet. When people eat a lot of meat, it causes an increase in prostaglandin production, which causes an increase in estrogen. So you need to decrease red meat in the diet or take it out of the diet for a while, and you'll see that it has a positive effect. Ginger is a natural anti-inflammatory, turmeric and cumin, cinnamon, these are all things to put into your diet on a regular basis. So yes, and stress, like Tara said, stress is such, because it intensifies pain. And so yoga, meditation, exercise, all of the things that you can do to reduce stress will also help reduce some of those symptoms. It's not to say that everybody can become completely hormone free, but absolutely getting rid of the antidepressant, bravo for you. I have women that come to me in menopause that are on antidepressants that need estrogen. It's a different problem, but they're mistreated because there's more than one thing that can cause symptoms, and we need to be diagnosticians, private investigators, and figure it out one by one. And not every treatment helps every woman, which is why Tara unfortunately had to go through 25 to find out. And the other thing that you're absolutely right about is women are told they can't get pregnant. And I've seen also in my practice, women with endometriosis get pregnant without any help as time goes on. And whether it's treatment worked or because they reduced their stress or they gave up, when you put so much pressure on yourself to get pregnant, that can interfere with getting pregnant. And people don't realize that either when they're infertility patients, all going through IV. It's the same thing. That stress works against well. But yes, you're a great patient in terms of how you utilized all the different modalities to help yourself. Did you end up having surgery at all?
Yes,
Tara?
I did. Yeah, I did. I had ablation. So for people who have endometriosis, and I'm sure Dr. Troy, you can explain this better than I can, but the ablation surgery is what I had, and they said that I had stage 2 endometriosis at that time.
Okay.
Yeah. Yeah,
Okay.
I'm sure you can explain the excision versus ablation if you like.
Yeah, so ablation is just like this picture that I showed earlier with the laparoscopy on down here. Oh, get this right. There we go. So they go through, they identify the implants, and then they can put instruments into the abdominal cavity. I'm a little off. There we go. Instruments into the cavity that can cauterize the implants. That's what an ablation of endometriosis is. You go into the abdominal cavity, it's filled up with carbon dioxide, so you have a space to work in. And then they go from implant to implant, and it's actually cauterized or burned. And by doing that, you can reduce the pain, you can reduce the disease in the pelvis. Sometimes adhesions will be there that need to be cut. Sometimes an ovary can be all clumped together and stuck, and it might need to be removed if it can't be freed up. And in reality, if you can even leave just an itty bitty piece, 10% of an ovary, you have a chance of getting pregnant again. So they don't have to take the whole thing. If they leave a little bit, it will still have a positive impact on your body and be able to give you an egg and get you a baby, so
Now,
there is
you
hope out there
mentioned,
for women that haven't.
Tara, you mentioned that you were in stage 2 when you had that procedure done. Now, Dr. Troy, when you showed the diagram, you meant you showed someone, you said that was stage 4. So can you go through the
Correct.
stages for me?
Yeah, so stage 1 is mild. Stage 1 would be mild disease, where you might have just a couple of little spots in the pelvic cavity. Okay. Stage 2 is a little more significant, where you have some scarring. Okay. And you may have multiple implants. And all you need is one implant that's sort of deep, and you can have pain if it's on a nerve. Stage 3, you have a lot of pain, multiple implants. You usually have moderate pain, and you have cysts occurring, which are over here on this side. Okay. And stage 4 is over here, where it can actually spread all over the abdominal cavity. The ovaries can be involved, the uterus. Stage 4 would be a case for a hysterectomy, usually, where they would have to take at least one ovary and the uterus and take down all the adhesions and ablate the endometriosis. And it's pretty extensive. However, if you can get through that surgery, you will be relieved most of the time from a significant amount of the pain. It can recur. You can have implants in somebody who hasn't had a period yet. There are all kinds of weird cases where you can have endometriosis, and you would think that these wouldn't be people who can have it, but not in menopause. Thank goodness. Once you're there, honestly, you're out of risk for having those symptoms, because it will go away. But until then, you've got all these. There's a lot of different ways to treat it. And people need to know, if they're having pain, they need to get evaluated. Don't live in silence with pain. Whatever pain you're having, vaginal pain, pelvic pain, women live with pain. And sometimes they think, oh, well, I'm menopausal and it's normal to have a dry vagina and it's supposed to hurt. No, it's not. It's normal to have severe menstrual pain where you're keeling over and you're having fainting spells. That's not normal. And for a long time, you thought it was. And that somebody should have told you this is not normal. Okay. And that's really, there's a lot of ranges of what is normal, but that's not normal. Okay.
Yeah.
And women need to.
I'm sorry.
I was just going to say, women need to know to get evaluated by somebody.
Well, that's what I was just thinking. With these 25 different treatments, did you go through this with the same healthcare provider, or were you bouncing around?
Yeah, that's a great question. A lot of the, so I did not go with the same healthcare provider, because they tell me I don't know what to do. There's nothing I can do. Go to this other person. So I was being sent to different people. And a lot of the time, which I hear from a lot of women who have who have the same symptoms that I did, they end up in the emergency room. And they spend a long time there, maybe 8 hours or whatever it might be, depending on how busy it is. They are given a stronger painkiller and told to go home, try this one. And, it's not for long term, and warning them of long-term side effects, which was something that was always in the back of my mind as well. But yeah, it was bouncing around. And I also wanted to add about after, so the surgery I had in 2017, and 3 weeks later, after I had my ablation surgery, my pain was back, but much worse. And then it was in 2020 that I started working with Wendy and implementing the strategies and tools that she taught me. But I wanted to see, Dr. Troy, can you confirm, from what I hear in my own experience, people say that the pain level does not coincide with the stage of endometriosis. Is that true?
That's That is correct. It always, just like you can have mild to moderate. All you need one implanting on a uterosacral nerve. It could be on all of your peritoneum, but not rest. You wouldn't know it was there. But if you have one implant that's growing in an nerve, that's all you need. So you don't have to have a pelvis full of disease to have pain. So yeah, it is true. But there are others that do. But there's women that'll come in, they'll have 2 little spots in there, and doctors won't be impressed. It doesn't matter. They're impressed. It's the cause of your pain. And if those little 3 dots are taken care of, usually that will take care of the pain symptom, if it's related to those, of course. But you're right. It doesn't always correlate.
Yeah, awesome. That's super helpful, because I think a lot of people, it would just be the initial thought would be like, oh, stage 1, not super painful. Stage 4 would be, you're probably stuck in bed all the time. But yeah, it can be exactly as you said. It doesn't have to match with the number of stage.
Now, Tara, let me ask
and
you.
Sometimes women.
Sorry, I wanted to ask about you changing and implementing these habits, which, as Dr. Troy mentioned, the foods of having the anti-inflammatory, properties, of course, help. Now, what were your eating habits before then? Because in my mind, I'm thinking, well, are you eating, just
that
for lack of better terms, crap, or
that is a really great question. It's really interesting, because I talk to women all day who have endometriosis now. I love to spread the word and to share the hope with them that they don't have to be stuck there. And so this is my experience, and what I've noticed with a lot of other women is when you're in survival mode, when you don't have the energy, when you're in so much pain, a lot of pre-made meals are your go-to. Like you'll do the pre-made pasta that you just have to boil in for 6 minutes, or you'll do what you have to do because you have work, you have family to take care of, and that was what I did when I was, and it contributed to my pain. And it's really interesting talking to different ladies and girls as I go through my day, and so many women will say, I crave chocolate or something like that when I'm on my period. But it's really interesting to look at what is the deeper need that your body is asking for, and a lot of times it's a nutrient that you're missing, that your body's crying out for, and that chocolate is not going to give you. It's funny because you'll see like jokes or whatever about chocolate being oh, she's on her period, but it's really your body's crying out for something, and we aren't taught that in school.
Dr. Troy, is it the magnesium?
There's trace minerals in chocolate. And so sometimes, you're right, chocolate has some of that in it. You're right, it doesn't have the nutritional value unless you're for like 85%, of course, but it does have some. That's why women crave chocolate. It's true. So there are trace minerals and nutrients in chocolate that satisfy that craving. It's not to say if we're not really bulking up on the vitamins our body needs that we probably won't have those cravings. But
interesting. And I have a question for both of you. I didn't know it, and I thought it was so ironic. I found out, I was today old when I found out that this is Endometriosis Awareness Month. Did you guys know?
I didn't know that, but my sister said that there have been celebrities doing news in different magazines. I think Irwin's daughter, Bindi, had endometriosis, and she talked about it in People, and there are other celebrities coming out and talking about it. So it's good that we're talking about it, because the more awareness we give to this and hopefully open the door to more discussion, pelvic pain is something women don't like to talk about. It can be really related to a sexually transmitted disease. It can be related to an abnormal pregnancy. It can be related to endometriosis. There's a lot of reasons for pelvic pain. And so when women have it, really should get a pelvic exam, get cultures, get a sonogram, be evaluated for it, and not think that this will pass, especially if it persists for several cycles. You know, everybody can have one
how
bad
long
cycle.
did you wait? Because sometimes, I mean, I'm guilty. I'd be like, oh, it'll go away in a couple of days. So just for for informational purposes, what if sometimes, just being honest, I move a lot. Sometimes I move the wrong way. So, I may be like, "Ooh, well, maybe that was from." So, how long should the discomfort or pain persist before I say, "Ooh, I need to get in there and see Dr. Troy"?
Okay, so if you're a teenager and you start having bad PMS, painful periods, I have a little regimen that I recommend. Calcium twice a day. So if you have daughters who are PMSing away, calcium has been shown to reduce menstrual cramps and PMS. So 500 twice a day, and you got calcium with D, even better. It's a split dose for better absorption. So 1,000 to 1,200. But if you add that to your daily diet, it will improve PMS symptoms and cramping. So I always recommend that. And raspberry tea is a natural coagulant and will reduce menstrual flow. So add that to your daily diet every day. Doesn't matter what you put in it. And then vitamin E for the breast pain, because when we get tenderness during that stimulation of the breast tissue, vitamin E can help reduce breast tenderness. And it's also good for your skin, hair, and nails. And it's an antioxidant and lowers fats in the blood. So those are all things that I would recommend to start. And as soon as you have the first cramp, you want to put on an anti-inflammatory, an ibuprofen or an Aleve or an naproxen, because the cramp is because of prostaglandins. And the more prostaglandins you have that are produced, the more cramping you get. So if you can suppress right away at the beginning of the period, the cramps, you're going to have a much better cycle. If you wait till you're in the full throes of the cramping, you can't stop the prostaglandin production anymore. It's already there. Then I go with acetaminophen. I go with Tylenol. Tylenol is great for pain. People don't realize how good it is. And I had the worst period of my life when I was 18. I was in school in New York City, and I had so much pain, and I didn't have Tylenol, and I had to go 2 blocks to the deli to get Tylenol. And I thought by the time I got to the deli, I was going to die. I had such horrible. I had to sit down in the deli, and I thought I was going to have to call an ambulance. I got the Tylenol. I made it halfway home and I threw up in the street. I got it was horrible. And I vowed I would never have a period like that again. I did go on birth control pills to help regulate my cycle. And for years I was on them. And shoot, I had 2-day periods. It was wonderful. There was no pain and it worked for me. And I was so grateful. But I can totally relate to somebody who has periods that will, all you need is like that to knock you out and help you to be at least empathetic to somebody who is suffering from that. But so that's what I would try. I would try all those non-hormonal things first. And then I would start with the birth control for suppressing the cycle, suppressing ovulation. And I prefer the monophasic pills because they're steady state the whole month out of the low and high dose, which more mix and can provoke PMS symptoms. Steady state is what you want. It's much better for PMS. But so that's where I would start. If pain persists, after 3 to 6 months of that, then you need to further evaluate. You wouldn't wait a year. Okay, that would be too much time. And the doctor has to be willing to be on top of it and the patient and do their detective work. Because teenagers aren't so good at following up. And don't forget, you're also treating a parent as well when you have a teenager who's going through this. If you're an adult and you're suffering, these regimens will still work for helping your periods be more comfortable and reducing PMS. And there's no reason why you can't start with those things and the anti-inflammatory diet, and the exercise and all of these other things. Mm-hmm. But you have to be reasonable and know yourself well enough that if in 3 to 6 months you're not getting improvement, then take the next step. There's reasonable time frame, and then there's you waited too long and you're suffering unnecessarily.
Right.
And
Well,
so, and because
what's funny about the suffering unnecessarily, again, I was today old when you said something about the cramping. I am one of those people who I don't really like to take anything, if I can help it. So, I'm 42. But I really believe I'm in perimenopause already. They start very young in my family, and I'm back on birth control. I actually had to up the dosage of hormone level because I just wasn't doing well without it. And with I actually have begun having what I consider real cycles. For a little bit, like you said, I did the birth control patch. But then I switched once I got back on, once I realized I needed the hormones. I got back on birth control because my cycles were so heavy, and then my symptoms were terrible. But then I got on birth control, and I had these little 2-3 day periods. I'm like, yay. Now I'm back to this whole, kind of like 2 week cycle, the
okay,
PMS, the this, that.
now the regimen needs to be changed again because your body's been changing. We don't stay the same. And women get blood tests to check about their hormone levels, and they do saliva tests. A blood test is a moment in time, and ovarian production of hormones is pulsatile. So if you check on a day of production, you're not going to really get the answer you're looking for. I have a 20 symptom checklist. If you're on that checklist, then I don't need to do a blood test. And then I would do a 3-month trial. Now, anytime you have perimenopause, you have to check thyroid, because weight gain, depression, forgetfulness, and fatigue, lethargy, all of those can be thyroid as well. And depression, they cross over. And so you have to evaluate the person. I always get a thyroid test just to rule that out if doing a blood test. Okay. But if we do a 3-month trial of hormonal treatment and it improves the symptoms, because we look at the list again after 3 months, then we know we're on the right track. Okay, so that's
with all of this regimen that you suggest, it can just really help every woman. Is this something that you would say that
it can.
maybe you suggest that someone do? And then of course
all teenage girls should be on this.
Okay. Tara, do you think if you had
moms who have daughters, they don't realize.
Tara, do you think if you had began eating well or better years ago, that you would have continued and be to with your symptoms like you did?
It's really interesting because I talk to women who are suffering all day long, every day, and I hear what you're saying, Dr. Troy, and that's great. It's great, the different things that are available to help people. But I think I understand from my own experience and from talking with other women what's going on inside our heads. There's a lot of shame. There's a lot of guilt when we can't do what we are expected to do in our workday or in our family, and that adds extra stress. And I personally went through a lot of stress I think mostly because of my personality, that I didn't know how to deal with stress. I'm someone who is very empathetic, and I'll see someone who is not doing well, and I took that in to myself, and I felt for them, and I did that for many, many years, and grew up with a very just always stressed, always in fight or flight mode. And so the foods help, but there's a lot of other elements to it. And from talking with other women, that shame and the fear and the anxiety of like, will I faint if I go for a walk right now? Will I be able to make it through my day? I have meetings till this time. Will I be able to have children? All these questions that are being thrown around in their head cause more stress. And the
Mhm.
program that I help with now, which is Visibly Fit, we have a big focus on faith. Wendy, who I work with, loves Jesus. I love Jesus too, and that's a huge part of our program. We believe that that we can't do it all ourselves, and that we whatever you believe, you're free to believe what you believe, but that's what we believe in our program. And just talking with so many women who carry that stress and that shame is a big reason why I believe they don't go and ask for help, and why this is one of the first times that I'm sharing my story publicly, is because there's so much shame wrapped around in women's issues. And
Mhm.
I'd be picked up by my husband at work, and I'm not going to tell my coworkers why I'm leaving, why I look so pale, and why I'm doing what I'm doing, walking around with a heating pad or whatever. And so I think that shame was the one of the biggest contributors. And I think that one of the biggest ways that we can get support and help is to know someone who understands what we're going through. Sometimes we look and we're like, does anyone know how I feel right now? Your husband or your friend or another woman might be
Mhm.
comforting to talk to,
Mhm.
but to talk to someone who's been through it, and who's
Yes.
been gone through the different things, exactly what you're feeling, who's willing to talk about it, I think
Mhm.
means a lot. And I know that when I was in my hardest times of being in pain, I had this, I still remember thinking, I'm going to make it through this, and I'm going to be able to help someone when I get to the other side. And
Mhm.
if you have a woman in your life who's struggling, and you've had different things, like how Dr. Troy's describing, there's different things that maybe work for you, or maybe like me, you're thinking about the long-term side effects, and those aren't those don't seem appealing to you, those long-term side effects of different drugs or pills, or whatever it might be. That's what I stand for, is the natural ways, and releasing that shame, and walking in ways where you love yourself, because hating your body and working against it and feeling like you're always fighting it doesn't
Mhm.
help to release that pain.
That's so great. And you having an organization that can educate women is exactly what you should be doing. You sound like you're absolutely wonderful at it, and sharing all of the different ways. Now, what I would say is hormones for the long term really don't have any risks. And I say that because I've been on them since I was 18 in my 60s. Okay. I should be in one of the studies. But the reality is, if you're healthy, you have minimal risk factors, and you take care of yourself, your risks are really low. We all have ovaries for 45 to 55 years making estrogen, and we're not all getting breast cancer. We're not all getting ovarian. Estrogen is not the cause of cancer. It can be a factor involved, but it is not the cause. And so people need to stop that fear of estrogen. If you have blood clots, if you're a smoker, if you have a family history of cancer, yes, your risks are higher, and you have to be more cautious. And perhaps you'll just do a topical instead of something by mouth, which bypasses the liver and is less absorptive. Okay. But just so you know, and it does lower your colon cancer risk by 25%. And 10 years of birth control pills also reduces your ovarian cancer risk. So you know that they can have some positive impacts body, as well as reducing the pain of endometriosis. And for Yana, there's 90-day pill packs now, so you don't have to have a period every month. You could have 4 periods a year if you want to be on a cyclic hormonal regimen. We also stop your periods by skipping that off week, or just putting you on a continuous hormonal regimen. And the way to do that, though, is once a year to get an ultrasound, look at the lining of the uterus, and make sure you're not getting overstimulated. That's the main thing. But I look at estrogen like water to a plant. Our bodies need estrogen. When we go estrogen deficient, we dry up, we shrivel up, and we die. When our thyroid stops working, we get replacement. When our liver stops making insulin, we get insulin. So why is it so horrible that we want to maintain our estrogen and progesterone and testosterone balances as we age? I just throw there because it helps reduce the age process. It keeps us healthier. And we want that quality of life. Another thing you said, Tara, which is really important, is we are always last on our own list. We're busy taking care of our jobs, our partners, our homes, our parents, and we are last. And women wonder why they're so tired and don't want to have sex at the end of the day. It's because they're too busy taking care of everybody else. Okay. And really, we have to carve out time for ourselves. You have to make time. 30 minutes, go sit outside, take a walk every day, 30 minutes, and still take care of everybody else. But on the weekend, if you have kids, get a sitter every other weekend, take a day and be with your partner. You know, the very first time my husband and I got a babysitter, we slept for 3 hours. It was the best 3 hours of sleep we'd had. My kid was months, we were exhausted. I tell you, you have to take care of yourself. You know what? If you take care of yourself, you're better able to take care of everybody else. Think of yourself as a bank account. If all you do is give and give and give, there's nothing left. You have to put back. You have to give yourself the time and the energy you deserve to be, so that you can move forward and take care of everybody else.
Yeah, I love that. Like, that's the positive. Like, that's the best way to go up. Like, because in the end, like you said, is us, you know, with our issues, you know, us kind of keeping it to ourselves, because like you said, we have so much, you know, many other responsibilities and things to do. Of course, you know, is finding what works for you. You know, what works for one person isn't going to work for another person. Like you said, I'm with Dr. Troy. I actually would love if the next conversation could be about aging and those things, because I realized that for me, it is, I am all for, you know, now I will be more conscious to put more not magnesium, what did you, magnesium into my diet.
Magnesium.
You know, I will, you know, be
and
more,
vitamin D.
Okay.
Vitamin D is the other one. We don't take enough D, and D helps with energy levels, and it helps with immune and healing. And C is a precursor for collagen. So as we age and we want better skin, add collagen to your diet. I'm a big C, D, and E person.
C, D, and E. Well, I think that should be a great conversation. I think that's going to be our next chat. But I do thank you, ladies, for jumping on and just sharing your information. One by one, if you want to go and just let everybody know where they can find you, where you're at. So that way, you know, because like you said, Tara, you're in Canada. I mean, but as we're not in Canada, so as long as there's internet, you can help everyone. And Dr. Troy, she has her platform as well, that and also locally. So go ahead, please do share, tell, how do we reach you?
Yeah, I'm on Instagram, and you can reach me online through Instagram, at Tara Endostrong, and I'd be happy to connect there. I talk to women all the time, and yeah, just to connect and know that you're not alone. And if you're looking for encouragement, I share encouragement there as well.
Nice. Dr. Troy?
Well, I love to educate women. You can read about information we've already discussed here at cosmeticgyn.net. But I also have a podcast, out there called Female Anatomy 101, which just gives women some basic information about their body that their doctors may not be giving them. And so take a look at that. And if you have questions, you can reach me through my website or at cosmeticgyn.net.
Awesome.
Cosmetic
Well, once again, thank you, ladies. I'm
Okay.
sorry. Once again, thank you for jumping on and sharing your knowledge and your time. Again, these women are a wealth of information. So if anybody is out there that is suffering, I was telling my girlfriend, I said, yeah, I'm gonna have a. I said my topic this month is endometriosis, and she said, what's that? So that let me know that this was something that definitely needed to be spoke about, right? So I do thank you once again for your time. And like I said, if anyone is out there and wants to reach out, please do. Remember that Wanna Go Fit is based out of the San Antonio, Texas area, and we are saving the world 1 pound at a time. So enjoy the rest of your day. Thank you very much. If you are looking for any type of encouragement, please reach out to Tara. If you're looking for any type of medical advice, please reach out to Dr. Troy, and have a great day. Thank you very much, guys.
Thanks so
Have a
much
good
for inviting
Thank
us. It was a
you.
pleasure meeting you. Bye.
Good to
day.
meet you.
Bye, guys. Have a great day.
See you next time.
Yes, ma'am. Definitely will be in touch. Have a good one.